Hello and welcome to the Cardiff University School of Healthcare Sciences. My name is Craig Griffiths. I'm the admissions lead on the Operating Department Practice Programme, and I'd just like to welcome you to this talk. Hello everyone and welcome to the talk for Operating Department Practice. My name is Craig Griffiths, as you can see me here. I am a lecturer and the admissions lead for Operating Department Practice, and today I'm going to give you a talk to give you guys a little bit more information about our course. So this talk will involve, unfortunately, it will start off, I'm going to get all the boring bits out of the way, the boring but necessary bits that you need to know for when you're applying for this course, and then we're going to jazz it up. We're going to take you through why you should be an ODP, and eventually I'm going to tell you why you should be an ODP at Cardiff University. So, one of the most important boring bits, entry requirements. So we accept 5 GCSEs grade A to C or 8 to 4 in new money, and that's our UCAS points tariff right there, which typically is a 3 A levels at BCC. We have no subject specific requirement. That's because you tend to make your A levels based on the choices you made at GCSE, and you make those choices when you're 14 years old. We don't expect to punish you for a decision you made when you were 14, otherwise we wouldn't get anywhere. We do accept other qualifications, so please contact HK Admissions if you're unsure about your qualifications, and they'll be able to direct you either to me or actually direct you to the correct qualification that you need to do based on what they know. The interview process, again, I'll just touch on, is what's called a multiple mini interview. It'll be a day where you'll have an introduction. There'll be 6 one-on-one interview question stations, a bit like speed dating, and then you'll have a debrief, okay? The only thing we want to hear from you for the interview is honest answers from yourself. I'll show your best self when you're applying for this course. Another part of the essential entry requirements is the disclosure and borrowing service check and the occupational health questionnaire, in which you may be required, in fact as part of ODP you will be required to undertake vaccinations in order to undertake clinical placements safely. Again, any issues you have with that, please contact HK Admissions and they'll be able to see if there's anything we can do, or if it actually means that you wouldn't be able to continue this course if you had any objections to that. In terms of placements, the programme itself, you may have heard, we are an all Wales course. What we do mean is that this bit here, this little pocket called Cardiff and Newport, and that is not all of Wales, believe it or not. This big country here is all of Wales. And yes, so what tends to happen is you will be placed in one of 6 health boards. We don't tend to touch Powys because they don't do enough operating for us, but one of the 6 health boards you will be placed in for the entire 3-year duration when you are on placements, okay? If you've got any more questions about placement, that will come out at interview, and if you have any more issues, feel free to contact me directly. There is also the opportunity to have elective placements in the second year. These are 6 to 8 week placements, and you can go anywhere, though the onus is on the students to organise that. So you can go abroad. We have had students that have gone to Nepal, Sri Lanka, New Zealand, places like that, but the onus is on the students to organise, and academic criteria therefore must be met. If you have organised a placement but you do not subsequently meet the academic criteria, we will be forced to cancel that placement, even if you have put a down payment or a deposit down. In terms of funding, I am not a funding expert. There are many funding paths, and I highly recommend you listen to the talk on funding by the Advice and Money service that the university have. It is fantastic and they know far more than me. Alternatively, get in contact with them and let them explore your options, because they may not be as obvious as it first appears, but ODP is covered under the NHS bursary in Wales. Right. On to the exciting stuff now. So what we're going to do is I'm going to tell you an ODP story in 3 acts. We've got 3 people who we're going to represent the sort of journey of an ODP over time. So we've got Katie, we've got John, and we've got Mark. Katie's a student, John is a newly qualified practitioner, and Mark is a patient. And through them, we've obviously changed their names, changed their appearance, everything like that to keep everything confidential. But what we're going to do is we're going to have a look at their journeys and how it relates to our course at Cardiff. Katie, we're calling this section the humdrum. So in every job, I don't care what you do, there is something called the humdrum. So the thing that you do every single day without fail, that's the boring stuff. So if you work in A&E, yes, you get very exciting stuff like you see in that 24 hours in A&E, but you also are fixing up legs that are broken, you're helping drunk people get sober, you're doing cuts and scrapes and everything like that. You get the boring day-to-day stuff, essentially like our man here is doing a bit of data entry. With Katie, her humdrum is a little different, at least I believe. So Katie's a third year student. She's on a placement in surgery, in general surgery, and she notices during the middle of surgery that the surgeon has unfortunately hit an artery and there has started to be quite a big bleed. Now, the operation they're doing is called a hemicolectomy. As you can see here, they're going to take this bit to the left, the ascending colon, they're going to take that away, and in cutting through the layers, the blood vessels here, the surgeon has accidentally hit one of these vessels, which as you can see is just off of our aorta, and that means that that vessel is now bleeding without any pressure on it, anything like that, profusely. So Katie is well aware of this. She's well aware of this because of the training she's had. So over the 3 years, Katie will go down the foundation year, laying the groundwork in year 1. She'll get all of her anatomy and physiology. She'll develop that further in year 2, both in anaesthetics and surgery. And in year 3, she's really perfecting those skills. She's looking after critically ill patients. She's looking at enhanced surgical practice. And she's also looking at how she can become a professional and doing her own research projects as part of that. A typical week for Katie in year 1 would have looked like this: 2 days for surgery, 2 days for anaesthetics and post-anaesthetic care. And as you can see on Thursday here, this will be a typical day. We've got 50% of our teaching is done in the classroom and 50% is actually done within our practical rooms. So Katie would have a good knowledge of the anatomy. She would have a good knowledge of the instrumentation she's going to use, both the theory and the practical behind it. And then in terms of the practical experience, when Katie's on placement, here's a typical week that she might have experienced while she was on there. There are tons of surgeries here, as you can see. I've highlighted Monday and Thursday. Monday, you've got a whole variety of surgeries that you might do, and then you've got circulated, so that's when you're assisting the people who are already scrubbed up, got their hands washed at the table, and scrubbed would mean that you've got your hands washed, you're the one assisting the surgeon at the table. And you'll notice on Thursday we've got this pylorus preserving pancreatic duodenectomy, or which is known as a Whipples if you've ever heard Dr. Bailey on Grey's Anatomy. Now Katie would have done a variety of these cases throughout her 3 years, probably going up in difficulty and complexity as she got better and better. And this PPPD is one of our longer procedures, one of our complicated procedures. It's for pancreatic cancer, and it can last anywhere between 6 and 18 hours. And so she might have done a scrub for that for the whole day. She may have even stayed on so she could finish that case, or if our mentors might have been very kind, they would have relieved her early to give herself a break. But as you can see here, throughout this entire week, I think this is 1 week of general surgery. So this is 1 week of one specialty, and this is her on the surgical side. So she's not done the anaesthetic side for any of this. She's just focused on one side. And we've got about 20 odd surgeries here for 1 week of one specialty on one side of the table. To me, that is not humdrum. I don't see how you can look at ODP as a career and see humdrum when that is your potential day to day. So what does Katie do? Well, she takes all of this learning that she's done through her lectures, through her essays, through her clinical skills labs, and then all the stuff she's done over the 3 years. And she is well aware. She knows that the problem is the surgeon cannot see. Blood is entering the field. They cannot see. She needs to help them. She needs to provide them with suction, and she needs to provide them with swabs to soak up that blood. But she also knows there's an active bleed going. And what does she give the surgeon? Well, she gives him a clamp to stop the bleeding. As you can see in this image here, there's several clamps on these vessels, and that will enable them to then stitch the vessel up. Katie will do this potentially in an unsaid fashion. The surgeon won't have to ask. She will have noticed through her experience. She will have handed the instrument before the surgeon potentially knew what they were doing. The surgeon in this case was very impressed by Katie and commented it to her mentor, and that's because throughout her learning here at Cardiff, she was taught about the patient, the human being, as a machine. And when you can think about the human being as a machine, you can fix it. You can figure out what you need to do in order to repair it. But that sounds a little bit heartless, doesn't it? And that brings us on to John. And John, we're looking at patients as people, because John is newly qualified. He's been qualified for a couple of months now. He's working in a paediatric centre. And John meets Tilly. Tilly, very much like this picture here. Tilly's a 6-year-old, so a little bit older, and Tilly is coming in to have a brain tumour removed. She's coming in with her parents, and she's very nervous. The whole family are nervous. But John, as you can see, is a very nice guy, and he has developed at Cardiff what we call non-technical or non-clinical skills, these soft skills, because treating a machine is fine, but treating a human being is something completely different. So what does he do? So he notices that Tilly has got a toy butterfly, and he has a quick idea, and he brings himself down to Tilly's level. So they're at eye level, so he's not imposing himself. He speaks softly, and he speaks to Tilly. Yes, he knows Mum can hear, but he speaks to Tilly like a human being, like she's an adult, like she's in charge. And he talks to her about the butterfly. He's got a butterfly, and actually he knows that a butterfly, if she waits, if she watches potentially something on this iPad, or if she performs this task, then a butterfly might land on her hand. And so what they might do is they'll distract Tilly, and there'll be a little bite, and she might feel that, and Tilly will have had a cannula put in as safe as possible and as calm as possible, because John has instigated that. He's used those soft skills that he's developed, and he has used it in order to keep her calm and keep Mum calm, because Mum is giving over the most precious thing that she could ever give over into John's hands. And then, of course, whenever you're working in paediatrics, we talk about the magic milk, the magic sleepy juice, the sleepy cow milk, whatever you want to call it. He uses that, gives a sense of wonder, tries to take some of the fear out of the situation. We know there's evidence that children who have bad episodes of anaesthetic care can lead to problems later down the road, and John is doing everything in his power not to instigate that. And as you can see, another example, when you've got younger children, you get the family involved, and John will do that the whole way through. He's done it for ages. He's done it ever since he was a trainee, and now he's coming to a paediatric setting. He's doing it again now. And as I said throughout all of this, we're working in teams. I mentioned the surgeon, and in this case the anaesthetist. The anaesthetist wasn't necessarily mentioned because actually when ODPs take the lead in these roles, the anaesthetist, the surgeon, can just get on with their job. It is very much teamwork. It is very much a dynamic duo. Think of the classic duos. We've got Riggs and Murtaugh for any Lethal Weapon fans, Batman and Robin, that's continuously through comic books, and of course more recently Rick and Morty. We're a duo. We work together in teams, and part of being an ODP is working together in teams. And as part of working in teams, we'll do other skills. We'll get to practice tons of clinical skills that we do as part of a team, whether that be resuscitation or whether that be extra courses that we can do, such as Alert, 1,000 Lives, our Resus, and Prompt, our obstetric team working course that we do and we give our students as part of their course. So they come out of this with more than just a degree. They come out with it with qualifications that some qualified practitioners currently aren't able to obtain. But I've prattled on long enough, and I said I was going to sell Cardiff, and I haven't really given my big Cardiff pitch yet. And that's when Mark comes in. And Mark is all about the Cardiff Mantra. So Mark was a patient who's 58 years old. He was very fit and well. He has a wife and 3 children. And during the pandemic, he caught coronavirus. And after about 10 days of worsening symptoms, he was sent to hospital with coronavirus. He was put on oxygen for 5 days, but eventually had to be sent to be intubated on day 6. The intensive care unit was full where he lived, so actually he was put into a converted recovery bay. ODPs during the coronavirus pandemic have been manning these recovery bays, have been looking after these patients in ITU. So Mark would have had care from an ODP at some point, if not for the entire duration of his stay in intensive care. Mark was intubated, and as he was done so, the ODP would have absolutely made him feel safe just by holding his hand, giving them calm words, because for Mark this would have been a very scary time. Families, of course, are not allowed in during coronavirus into hospitals. Unfortunately, shortly after his intubation, while he was staying in ITU, Mark passed away. He had several cardiac arrests, and unfortunately, in the last one, they were unable to bring him back. But during that whole time, he had fantastic care. And afterwards, it would have been down to the nurse, or in this case, probably the ODP, to ensure after Mark had passed away, to clean him, to make sure that he was talked to while he was cleaning him, to make sure that he was treated like a person, treated like a human being, treated as if he were still alive, gave him the best respect he could have asked for. And while he passed away, they would have held his hand, because their family members couldn't hold Mark's hand. And that's really important. That's a really important part of ODP. But what does that have to do with the Cardiff Mantra? The mantra we have at Cardiff is simple. It's me and mine. And what we mean by that is that every student that comes out of the ODP course at Cardiff, we as lecturers would be happy to have them look after us or our families. And that informs everything we do, how we teach, what we assess, how we do our placements, how we pick our mentors. Everything that we involved in goes through this process of me and mine. Now, you're probably asking, it's a bunch of words, Craig. How do you practice what you preach? Well, Mark was my dad. And I think it's really important to say that he had great care. He had care by an ODP. And if that ODP had been a Cardiff University graduate, I would have been more than happy that he had the best care given to him possible. And we have students to this day representing Cardiff around the country, from Great Ormond Street, up in Scotland, in Wales here, and in Bristol. So if you want any reason to come to Cardiff University, it's that the standard we set for our students is that they would be able to look after someone like my dad, regardless of the outcome. Thank you very much. If you have any more questions, feel free to contact us.